frustrated. And after they are frustrated, they go, oh, but I use a good cream, I make all the treatment, and I don't see any difference. That's why I love chemical peel. 95% of my patients, they perform chemical peel at home. We give them the products and they perform it alone at home, but they are very good instructed. And they come after in our clinics to make at last 1 metal deep chemical peel. With PRP...
TCA, you say?
Yes.
General,
TCA
medium
or,
TCA.
Yes.
Trichloroacetic acid.
Yes, until 15%, but I go sometimes, I have also a combination with phenol and TCA, and in select cases, yes, not phenol alone, but it's a combination with phenol and TCA, and it works also very good. And in very selected cases, and if the skin is very good,
maybe for smoker lines.
Yes.
And crow's feet.
Yes, it works very good.
Oh, very good idea.
Hyperpigmentation, it works really very good, but the patients, they must be very with a high discipline, because they have to perform at home. So in selected patients, I perform also combination with phenol and TCA, and it works really very good.
Well, but what about PRP and skin booster?
PRP, I call PRP like a skin booster because it is, I love PRP, it's amazing. And I combine it with chemical peels, not in the same season. Example given, we perform 2 times chemical peels, and after I suggest to my patients to perform PRP, especially if they are very young. And I suggest them to perform at least 3 treatments, because 1 treatment between us, it's like nothing. That's why I suggest them to perform 3 treatments, and they love also, because some patients, they don't want synthetic materials in the skin, and they say, oh, I want something very natural. So it is something very, because we take the own blood, and we inject after the platelet with the growth factors, and it works really very good, especially for the periocular area. It is really amazing.
Yeah, this is a recyclable treatment to use. I love to say to my patients that I use your pieces for you.
Yes.
You understand? It's not a strange thing. A PRP comes from you, exactly. So it's very interesting, isn't it? But you know, Dr. Ingold, sometimes we were talking about Sculptra and PRP. Sometimes I mix PRP and Sculptra for giving the patient the firmness of the face, and this is very interesting.
Wow.
We mix generally 2 cc, one vial of Sculptra. I prepare with saline, generally 5 to 10 ml, and the same amount of PRP. And I mix, and we inject it all around here on the sides of the neck. It's very interesting.
Wow.
But I know, yes. Well, this is why I say that we can play with many options today. I love to say also that in the middle of 90s, you see the color of my hair, I'm getting old. I saw a lot of things. And in the beginning of my career in 1991, suddenly it appeared Botox injection. And at that time, people were supposed to come to our offices and ask us about what is the best treatment for facial rejuvenation. At that moment, the answer was Botox. Then, with time, we began using Restylane. This was the first hyaluronic acid. So the answer for what is the best treatment for facial rejuvenation was Restylane injection. Then the next one was laser. But today, we have a myriad of things.
Yes.
That's why I love to say that this is interesting for us to play with options. Isn't it good?
Yes.
And the results are so much better than before.
Yes, indeed. I totally agree. And
Yes.
needs of every patient, because there are patients that, oh, I want only something natural. Okay, we have the solution. There are, I want something more invasive. Okay, we have the solution. So it's really amazing. Yes.
Yeah, yeah. And I know, tell me, because generally the live comes down after some 1 hour, I think. I would love to listen to you talking about Peleve.
Yes.
Peleve is
Yes.
the pronunciation.
Yes.
I know you have a huge experience.
Yes.
We don't have Peleve here in Brazil still. I see it sometimes in Dubai, but I have no experience.
Okay.
As I told you, here in Brazil and in Dubai, we use a lot of Ultraformer 3.
Yes.
This is the name of the machine, and the technology is the ultrasound, the focused ultrasound. This is very interesting for burning. Yes, I know. I love it for neck definition, for face definition, for because focused ultrasound, let's say it hurts, it destroys some specific points depending on the deepness, depending on the handpiece we use. We can use it, for example, 1.5 millimeter, 3 millimeters, 4.5, and 6. 6 is for fat. The others are for collagen formation. And this is very interesting. But I would love to listen to you talking about PLV. This is radio frequency technology, isn't it?
Yes.
Tell me about this wonder thing.
Can I ask you a small question about Ultrafarmer 3? Because we are going, I was so impressed about your experience and all that you explained me about the Ultrafarmer 3. How are the results for saggy skin in the body with Ultrafarmer? Are the same good like in the face, or it's less effective?
It's the same, because differently from another technology, it doesn't use light. As you know, if I use a laser, CO2 laser, for face, it's very safe. For body, it's not as safe as for face.
Yes.
Because a lot of things. The regeneration for body skin is not as safe as face. We do not have adnexes such as sebaceous glands and hair follicles. That's why face is so much safer when I use light as lasers, for example. CO2 laser, erbium. Today we have the thulium. The name is Lavian laser. But anyway, the question, when I change the technology, when I do not use laser anymore, and I decide for using ultrasound technology, it's very safe first, because it doesn't use light. It doesn't make no problem with the melanin. Your patient will never have a white spot or dark spot or whatever, because this is sound. That's why it's great and safe. The problem is that on body, differently from face, we have a higher amount, let's say, of elastic problems.
Yes.
It's very common for us to receive patients with abdominal wall, the abdominal skin with a huge laxity, and they think that those technologies could substitute surgery, for example. And even if you have done a surgery on your abdomen, but the quality of the skin is not good, for example, in Brazil, people, they took a lot of sun. Still today, I'm from a generation we used to stay hours and hours under the sun to be tanned, and it's horrible for the collagen quality and elastic fiber. So for body collagen induction, I think we need to improve the result with Ultraformer, that I love, with biostimulators. For example, Sculptra and the mixture of Sculptra and PRP.
Okay.
So I love it, but first I will explain my patients if they have an indication for surgeries, because you know it's very important. Some people, they think nobody does no surgeries at all. today we have lasers and technologies, and unfortunately, it's not true. We still have cases, very intense cases, that we need to cut.
Yes.
But for face, generally, the majority of cases, ultraformer 3 is enough. But for body, no. For arms, for example, for thorax, the lateral parts of the torso, abdominal wall, inner thighs, buttocks, I use the combination of ultraformer 3 and biostimulator, such as Sculptra, for example. Here in Brazil, we have another brand with polylactic acid. This is called Eleva. But it's the same.
Okay.
Sculptra and Eleva is the same thing, polylactic acid. So I love to do first for body. For example, upper abdomen or lower abdomen.
Yes.
No indication for surgery. Or a mild indication, but the patient doesn't want to have the surgery done. Then I will indicate 3 ultraformer 3s. And in the meantime, I will mix PRP and Sculptra, generally 2 or 3 sessions. So I will alternate. One ultraformer, 30 days after another one, 30 days after the third one. In between, Eleva or Sculptra plus PRP on a fanning technique. Okay. And there are a lot of papers, and they talk, we can get up to 40% of collagen formation.
Oh, very, very, very.
Yeah, it's interesting.
And
what about Peleve? Peleve.
We have a huge experience in our clinics, and it is based on the radio frequency technology. It means via heating, it increases the vascularization of the skin, of the layer of the skin, and via increasing the vascularization and via the heating process, we have a collagen stimulation. It is very easy to perform, and there are no collateral effects. But we inform all our patients that they must wait around 4 weeks in order to see a difference. And we suggest to perform at least 3 treatments, 1 month apart. And I must accept that the results are really very, very good. And especially for the patients who don't want to perform invasive treatments to achieve a tightening of the skin. And of course, before performing these treatments, we suggest to our patients to perform at least superficial and needle deep chemical peel after 3 treatments with PRP and after the radio frequency in order to achieve really very good results. Only radio frequency in a not preparated skin, it works, but the results are not amazing. So we prepare our patients, we explain to them all the options, and after they decide. Of course, it depends also on how old they are. If we have a lady who is 30 years old, the results are better in comparison to another one who is 40 or 50. That's why the key is the combination. Identify the right patients for the right combination, and to inform the patients about the treatment possibilities that we have, and after they decide. But I love this radio frequency technology. It works good alone. It doesn't make miracles, but in combination with other treatments, it works very good.
And the combination is with
chemical peels, PRP, and long-lasting. After example given after 6 months, I combine it with Radiesse or Sculptra. It depends on the case.
Very nice. Well, Dr. Ingold, I think we could make an encyclopedia with such very